Hello and welcome. The city of Chennai has gone back into lockdown from the 19th of June to the 30th of June, unusually because this is the first city or the major city in India to do so and might well set a trend for other cities in the country. But more than that, the number of cases obviously continue to rise across the country, and that continues to be worrying for everyone, including in government, public policy, public health, and of course those doctors who are fighting this battle at the front lines. The city of Chennai is a place that we've not yet visited in our conversations, and I'm happy to be joined by two leading doctors from the city to discuss where things are today, a sense of what's been happening in the last 60 or 70 days that we've seen these cases rise, and more importantly, what lies ahead from their vantage point as well as their ringside view. So I'm pleased to welcome Dr. Raymond Dominic Savio, critical care consultant at Apollo Hospitals, also the chairman of the Indian Society of Critical Care in Chennai. And Dr. N. Kumarasamy, Chief and Director of Infectious Diseases Medical Center at the Voluntary Health Services Hospital, and also running the Chennai Antiviral Research and Treatment Clinical Research Site of the US National Institute of Health, as well as part of the National Task Force on COVID-19 at the Indian Council of Medical Research, the clinical research part. So, doctors, thank you very much for joining me. And Dr. Raymond, let me start off with you. So give us a sense on what you've been seeing in the last 60 or 70 days as you look back in the way this disease has progressed, and also our ability to better understand and respond to it from a treatment point of view.
Okay. So it's not that the disease has progressed, maybe the spread has progressed. The disease has been the same. So the initial part of our COVID pandemic, you want me to restrict to Chennai? Yes?
Yes, I mean, as you wish. I mean, you can use Chennai as a base, but please talk about, national, international, that's your wish.
With the initial part of the lockdowns and things like that, so we did feel like we were doing great. We thought we were never going to face what the West was at that time facing. We thought we may not be the epicenter. So that was all only until the lockdown was there. And obviously, lockdown was not the answer for this. Yes. Of course, probably, yes, it helped flatten the so-called growth curve and things like that. But ultimately, this was what was anticipated to happen. And that's what we are seeing right now, which is a steady increase in the rate of transmission, I would say. Okay. And yes, for whatever reason, we have been fortunate in the sense our death rates or the case fatality has not been as bad as what we have been seeing elsewhere. I mean, you can attribute to various reasons, maybe the size of the elderly population, or there could be several reasons to it. We can keep contemplating. But yes, our case fatality has been less, and we still seem to be growing on the so-called flat part of the curve. But yes, our numbers are anticipated to rise. This is not something that we are surprised about, what we are seeing in the last 1 or 2 weeks, especially. And the way forward, yes, we have some various mathematical models which have predicted numbers. We may not be as bad as that, but we are still going to increase our numbers. We are going to see a few more fatalities, but I believe that we are reasonably equipped to handle it. But again, it's more of a prediction. You don't know which way the
Right. So you mentioned that you're not seeing so as high fatality as maybe other cities, and I'm sure you mean Bombay and Ahmedabad or even Delhi for that matter. Why is that? I mean, apart you mentioned age as one reason, and could there be any other reasons?
The number of comorbidities, that is, the existing illness, so that also tends to increase with the increase in age. And there was a significantly large population in the West that were above the age group of 60 to 70, which is not the case in our situation. And it's not peculiar to COVID. It's like with any other infection, any other infection is expected to tilt the balance in people who are elderly, in people who have more disease, coexisting. So that's just what we've been seeing.
Right. Dr. Kumarasamy, how are you viewing this, the manner in which the transmission has happened, our response to it, and why is it flaring up in the way it is right now?
Right. So again, thank you for inviting me to part of this program. So right now, I will stick to Tamil Nadu and Chennai, where we live and practice. We have almost around 53 to 54,000 infected confirmed cases in the state of Tamil Nadu. out of those, large numbers are from Chennai, so almost 38,000. So we have roughly more than 1,500 people being every day newly being confirmed in our state of Tamil Nadu, and out of those, nearly 1,200 from our Chennai, city of Chennai, in the last 2 weeks. So this is an area of concern. This is something what going to cause a grave situation on the healthcare system in future. So if you look into those infectivity rate, it varies from our district to district in the state of Tamil Nadu. If you stay to Chennai, where it's a very densely populated, people live very closer, where again, a lot of transmission had happened. And today, almost 12,000, 1,200 people are being newly infected almost every day, and it's been reported. So again, if you extrapolate all those data from our state of Tamil Nadu, I will call almost our positivity rate every day, is almost nearly 10%. So it has, it used to be 1% a couple of months back, gone to almost 3 to 5%. Now it's gone to 10% beyond. If you look into some of those data from our own hospitals, where we could see anything around 25 to 30% of the people who have suspected symptoms or who had been admitted in our hospital for various indications are tested positive. That is an area of concern. Almost 25 to 30% now off late we have been seeing this. Now coming to this, how these people have been doing well. Again, if you look at the overall data, in our state of Tamil Nadu, the mortality is only around 1%. It used to be less than 1%, which is now climbed in the last 2 weeks or so from 0.6 to nearly 1 or little above that. So again, but if you look into those mortality in the hospitals where patients who are really sick, come and get tested, still high because they present to our hospitals very late when they are moderate or severe, or they are being turned away from different hospitals in the final stages, and they come and die in one of those COVID treatment facilities. So again, mortality is much lower in our state of Tamil Nadu as compared to Maharashtra and Delhi and Gujarat. So this could be a variety of reasons. If you see when we started this pandemic in our state, our mortality is very low, and significant number of people who have been tested were all in the middle age group. But now the infections are moved from this middle-aged population to the younger one, as well as the elderly of 60 plus and 65 plus. So that means the middle-aged group have brought this infection home and been transmitted to their elderly population. And again, as you know that in India, or particularly in southern India, we have a high comorbidity, particularly with diabetes, hypertension, and renal disease and obesity. But again, all these add to this mortality. Right. COVID. So there's something to your questions why is a difference, because we saw young people in the beginning with less comorbidities, but in the last month or so, last 2 weeks, more and more elderly people getting infected with comorbidities where mortality has been increasing. If you see in the last 2 weeks, it's been increasing even in Chennai.
Right. And you did mention, and this is something that we've been hearing from the specialists in other parts of the country as well, that almost 30% in Mumbai, there are doctors who've told me that almost anyone who walks into a hospital today for anything is being tested positive. So what does that tell you, Dr. Kumarasamy?
I won't use the word everyone who's walking into a hospital is being tested.
I think it's a more figurative rather than literal.
Yeah, test everyone. We test with all the typical suspected symptoms, or anyone who has got a contact with confirmed cases, or they have been hospitalized for any other indications where procedures are going to be conducted, where for the safety of various concerns, testing is done, but still the care is being provided in the hospital. So this again, if you look at this particular number, it's around 30%. Exactly, I've been closely following this in the last 2 weeks. Almost it's climbed from 10% to 30% and above. But I won't say that means all the 30% of the people who are all tested in my state of Tamil Nadu are positive, because this is again a hospitalized population. That who goes to the hospital, who have been sick or symptoms, they wanted to be tested. But again, in our state as well as in the whole of India, we have very large number of people who don't have any symptoms. We call asymptomatics. They are already been positive. They do not know their status, because they are not being tested. And again, if you test this, then we will know the true prevalence in the whole population, and also we will know the true incidence rate, that is occurrence of new infections among the whole population. I think that type of...
But this, in any case, what you're saying is that we definitely have far greater transmission than we already know or are able to record.
Absolutely. Now, if you see these numbers, it's been rising. In India now, almost crossing 400,000 people across in India, and in our state of Tamil Nadu, almost 55,000. Every day we have been adding almost 1,500 people. And again, more and more testing has happened. More testing labs are being certified every day. So more testing will happen.
Right. Dr. Savio, can I come back to you? So, some of the critical cases that you're seeing, are the cases, apart from the age factor, which you've already mentioned, are there any other similarities or dissimilarities between what's the way it's progressing or the patients are progressing in India versus, or maybe specifically your hospitals versus what you're hearing of in either the rest of India or even the rest of the world?
So I would presume you want to know the percentage, whether the percentage of people infected who turn out to be critically ill, whether it is any different between India and the Western, or whether it is different between the states.
I mean, that's one. And also the nature of progression. I mean, is it the same? Are you seeing any news? One of the things is that, for instance, even in the last 60 days, the manner in which the disease seems to be overtaking the body seems to be changing, or at least, the way doctors seem to be seeing new signs which were perhaps not there in the early days, but are now quite evident.
Yeah. So I would say less than 30% of the people, of the overall infected people are probably getting sick. The real sick requiring ICU admissions or something like a high dependency unit. Of course, if you want to know the real figures on this, the national figures, I am not sure if ICMR has actually released anything about that. The percentage of people who need high dependency unit, who need a critical care admission. So that will be a worthwhile information if it does come from ICMR. But my rough estimation from, again, the institutes that I take care of will be less than 30% of the overall infected people. So that means to say the vast majority of them are just, mildly sick, or they can be managed in the ward. Okay, a majority of them can even be home quarantined. Okay, now coming to the sickest of the people who land up in the ICU, again, in that, I would say less than 10% or roughly 10% of them land up requiring what is known as a mechanical ventilator, which is an assisted breathing, using a respirator, a mechanical ventilation. Now, those are the people who really account for the mortality. So the mortality in this small subset of people who actually land up requiring a mechanical ventilation is extremely high, right? The ones who do not progress up to mechanical ventilation do fairly well. And again, this obviously needs to be stratified according to their age, according to the number of comorbid illness, okay? So we need to see this, we really need to dissect this and get to know these data. So I would say still the vast majority of them are asymptomatic. Some of them require ward admissions. A small percentage need ICU. Of that, a very small percentage are the ones who land up requiring organ supports. Those people have an extremely high mortality.
And is there anything that tells you, Dr. Savio, that this is the virus is behaving differently in your part of the country versus maybe other parts of the country, or for that matter, other parts of the world?
No, there's nothing that we actually see of that right now.
Right.
To that question, I don't think we have any evidence at this time to show that our viral strain is different from others. Initially, there was a speculation that the strain circulating in Asia, probably it is not that virulent. That's why people are not dying in Europe, in Italy, in Spain. A lot of people are dying. We don't have any evidence to show that. So one thing is correct what Dr. Diamond said, Raymond said, where a significant number of people who have been tested positive and in our large surveillance program, they're all totally asymptomatic. I will call almost around 80% of them, or 85%, who don't have any symptom, not even mild symptoms. And remaining the 15%, again, symptomatic, in that I will call 10% who really need inpatient care, where they are moderately sick, they need an oxygen support and supporting medications, or probably they may need sometimes mechanical, ventilation. So this is something what now we need to target on, where people don't progress to this stage. If we can, stop before that, then we really will disable them.
Right. Dr. Savio, what's your sense in terms of your capacity to respond? Now, unlike, let's say, Mumbai or Delhi, you're obviously still in control. I'm talking about the city of Chennai, but you have gone into lockdown once again, so I'm assuming that should help. But what's your sense of response, the bed capacity for COVID, number of doctors and nurses available at call? Give us a sense.
Yeah. So, see, there's a basic difference between the public sector and the private sector, okay? And between the number of critical care beds versus ward sort of beds, okay? Both sectors have definitely been increasing on the number of beds available for the less sicker patients who do not need ICU kind of care. So I have a feeling we will be able to manage through with those patients. And those are typically the patients who also have a shorter duration of illness. Their turnaround time, or probably what we call as the length of stay in a hospital, is going to be less than a week or close to a week. There's going to be rapid turnover of them. So for this group of patients, the ones who are not critically ill, we probably can still get away with it if this is the rate of increase, and hopefully with this lockdown also helping to reduce the rate of transmission. Now, coming to the critical care beds, that's where we are maximally stretched. Between the public and the private sector, we are facing something different. See, the public sector, yes, they seem to have increased the number of beds. They claim to have bought a good number of equipments in terms of ventilators and high flow nasal cannulas. There are several things that they seem to have invested in, beds and equipment. But whether we are equipped in terms of the specialist personnel, I am not sure. Okay. And the vast majority of the specialist personnel are probably concentrated in the private sector, where the bed strength cannot be expanded beyond what is available right now. Okay, so we are in a cap situation. So as of today, yes, we are stretched. The critical care beds are maximally stretched. Also the reason, because these critically ill patients tend to stay longer in the ICUs. They probably have anywhere between 2 to 3 weeks, or I've had people who've been with me in the ICU for 6 weeks and then get discharged. So if that's going to be the length of stay, the average length of stay, then naturally you can imagine the compounding use of beds. So we are likely to be in a crisis, but yes, each one of us have been trying to improve on our bed strength. There are more newer hospitals contributing to greater number of beds. And again, if I'm not wrong, the government is also on a spree in increasing the number of beds available in the private sector. The third problem that's compounding this issue is people's preference between the private and the public. So if everyone, and even in the public sector, if they're going to be, everyone's going to be choosing one center, and then that's going to be always full, the false sense of unavailability of beds is also out in the air.
Right. Right. Just a quick question there. You said that there are patients who've been in ICU for 6 weeks and then got discharged. And I'm assuming you're talking about COVID patients.
Yes.
But if that's the case, that seems to be quite encouraging, isn't it?
Encouraging in the terms of bed occupancy.
In terms of pulling through what is otherwise, I think in many cases, to last for 6 weeks in an ICU and then get out seems to be a good sign. I don't know. You'll have to tell us.
No, see, it all depends on a typical critically ill patient, with multiple organ failures. Okay, yeah. And who also pulls through additional what we call as hospital-acquired infections and problems inherent to staying in an ICU for 4 or 5 weeks. Yes, this is a typical course of illness for somebody who has multiple organ injuries, and it is not that somebody who has been sick for 4 weeks or 6 weeks will eventually die. No, there's nothing like that. It all depends on the kind of support that is available, the kind of infrastructure that is available, and sadly, I have to say that the kind of financial backup as well.
Yeah.
Because many of these people either do not have insurance backup, or even if they do have insurance backup, you don't expect them to cover this bigger period. So there are people who are able to sail through this, and they do well.
Right. Okay. Last question to you, Dr. Kumarasamy. So how are you seeing are you able to project now? Both of you seem to feel that things could be under control in terms of capacity of beds and the ability to manage pressures here on. Are you confident? What could go wrong, if anything?
I think, if you state of Tamil Nadu, which has got a better healthcare facility than many other states, we do have a good both public and private hospitals. And in fact, the public hospitals in the state of Tamil Nadu is much far better than many other states in terms of the infrastructure, the facilities available, and the expertise available. So that's something is an added boon for our state of Tamil Nadu. Now, of course, we have equal number of good private hospitals with excellent infrastructure. Some of them are world-class, to more than the international standards, and with excellent expertise. So to your question, are we really, prepared? If you see this curve, our numbers are going up. So 1,500 people every day in the state of Tamil Nadu, and out of those 1,200 every day in Chennai. Again, it's depending upon how many of them are now getting really sick with moderate and severe requiring beds.
Right.
Now, for example, in my hospital, someone comes to the outpatient clinic who have been COVID positive. If they are mild or if they can be managed at home, we don't inpatient them. We just we do treat their symptoms, and we do a lot of counseling on them. Make sure that they are at home with self quarantine in the house, and we do a lot of other counseling to the caregivers how they will be protected. So this is something what really will help our healthcare system. So we need to right now protect our healthcare system, not just admitting everyone who has been COVID positive. You don't need an inpatient care facility. Or also, government is been now developing what is called the COVID care homes, where people who don't need acute patient management by the doctors and nurses, where they can be housed in other quarantine facilities. So I think this is right, and the hospital should focus on moderate and sick cases. Right now, we have a large number of hospitals in our city, but also we should not forget that we have got large number of non-COVID people also requiring admissions, because diabetes is a major problem in our city. We have hypertension, elderly people numbers going up, cancer patients, patients with HIV, tuberculosis, many of them need admissions, and also we need places for patients to go for dialysis. Maternity centers need to continue to do deliveries for the needy population and the pediatric population. So we can't completely take away all the entire hospital, for COVID care. So for this reason, now government has requested almost 30 to 40% of your total bed strength can be allotted to COVID. This is something what we hospitals should be prepared and raise to the standard, raising their infection control practice, training their appropriate staff, bringing all those protectives and PPEs. This is something what is being needed. Again, to your question, are we really prepared to take care of everybody? I really do not know how this been, numbers are going up. If the way it's going up, and if it goes beyond July, I think we'll run out of definitely hospital beds in our city of Chennai.
In fact,
right, sobering note to end on, but that I guess illustrates the challenge ahead, not just for you, but all your peers all over the country. Thank you very much for joining me, and I do wish you all the best in this battle against coronavirus. Thank you very much.
Thank you. Stay safe.